Happy International Women's Day. Today is International Women's Day, and so this is something great, that on today is a day that we celebrate women, right? But for me as a plastic surgeon, we celebrate beauty, because beauty is something so personal, and a lot of people don't really kind of understand the whole concept of beauty. So I want to welcome all of you to joining me. Now today, as I mentioned, is International Women's Day, and this is celebrated around the world, right? But I want to start off with 3 words, and I want you to keep it with you. Write it down, and this is very important, and that is radiance is personal. Radiance is personal. All right, these are the 3 words. As a plastic surgeon for 40 years now, I've always told every woman who walks into my practice, those are the 3 words. The other 3 words, of course, we all are quite familiar, is I love you. But when you have radiance as something personalized, beauty then becomes just a word. All right, and age doesn't become a word at all, because it is personal. And whenever I talk about radiance is personal, it's because aging is not something that you can stop. Some people talk about reversing aging. I talk about smart aging, all right? And if you really listen to most of my talks, you will realize that when you talk about smart aging, the word smart, S-M-A-R-T, has the word art in it. All right, art. So there's an art in aging smartly, and that's what we want to really tell you about, because over the last 35-40 years now, plastic surgery, cosmetic surgery has advanced so much that we do less and less of surgery and more of non-invasive surgery because of technology. So I know it's lunchtime, and we want to talk about something quite light-hearted. But anyway, it's important that I tell you. And so Jane, yep, you're from Sabah. You could come and visit us. But all of you who are joining us on lunchtime, today is a month. I've declared this month, March, as Glycation Month. And if you can understand what is glycation, that's the key to smart aging. All right. So every treatment that I do here is focused on glycation. So remember that you can't stop growing old, but you can certainly delay the process. You can't reverse it. In some cases you can. When it comes to diseases, you can actually reverse the heart disease that is going on, and the problems of when you talk about cellular dysfunction. And if you get it right, you can actually reverse some of these processes. But when it comes to aging, it's an ongoing process. If you're driving a car and every car has got an exhaust pipe, there's no way that you can drive a car without that exhaust pipe shooting out fumes, right? So this is something that we take the car in for maintenance, we go in for servicing, so that whatever exhaust comes out, the pipe and the fumes, is not really mucky and contaminated. It is nice and clean. The engine is clean. So too with aging. People are living 80, 90 years old. Tun Mahathir, for example, is 98 years old, even though he has had 2 bypass surgeries. And while I'm still at it, since I mentioned his name, now, if you're really interested, follow me on my YouTube, Heart Talk with Dr. Charles Lee. Heart, H-E-A-R-T, Talk, one word, with Dr. Charles Lee. And that's my YouTube channel. And we've talked about fantastic guests that have come on my podcast. And so you can follow us on YouTube. Again, there is Plastic Surgeon Dr. Charles Lee. That's the professional channel. Of course, now Instagram, you can get me on Dr. Charles Lee Sabah. We are also on TikTok. All right, Dr. Charles Lee _ plastic surgeon. All right, so that's the TikTok that you can follow me on. I also have a private channel on TikTok, and and so it's Dr. Charles _ Lee. And then you can get us on Facebook. And so Facebook, the professional channel is Charles Lee Aesthetic Surgery. And then of course we have the other channels on Heart Talk Dr. Charles Lee. So we're really on the score when it comes to social media. So I'm putting this out to you so that you know me not just as a plastic surgeon, but also other areas that have kept me going over the last 40 years. Now, so coming back to plastic and cosmetic surgery, beauty is really central to everything that we do. Plastikos comes from a Greek word, all right, called plastikos. So plastic comes from Greek word plastikos, which means to mold. All right, you get something like a piece of clay, you mold it. So that's plastikos. Cosmetic comes from a Greek word called kosmetikos, which means to adore. So you mold something and then you step back and then you adore what you have molded. That's how we get plastic and cosmetic surgery. So coming back to beauty, and today as we celebrate International Women's Day, I want to talk to you about a process called glycation. So, you know, when two people fall in love, there's a reaction that takes place. And that reaction can sometimes be a physical reaction, and it can also be a chemical reaction. You know, you hear of, having a chemical attraction to somebody. So sometimes chemical, and that's really deep because it's at the molecular level. When you're attracted to somebody, it's not just a physical attraction, but there's also a chemical attraction where your heart rate goes faster and you really get palpitations and you get worked up because it's something really, really deep. So too with aging. So too with the metabolic processes that go on in our body. And so glycation is an aging process that is called cross-linking. It's a process that involves cross-linking of different reactions that take place in the body. And it's really something very natural that occurs every moment. Even while I'm talking, I'm aging, all right? And this reaction, this cross-linking reaction is between two things. Just remember, natural occurring sugars, for example, glucose and fructose. And this chemical reaction, this cross-linking damages what are protein and fat molecules. That means proteins, all right? And these proteins are in the dermis of the skin. And so that's why it's so critical for you to know this word glycation, this term glycation, because it happens to every cell, every tissue in the body. And because some of these reactions that take place are irreversible, and this is one place where you can actually reverse it. And when you reverse these reactions that prevent the bad actors, the bad products, which I will talk about, you can actually delay aging. All right? And in some situations, in some circumstances of diseases, you can actually reverse it. So these are the two things we talk about when it comes to aging. Now, so this is a process, and it's a process that involves a non-enzymatic reactions where there's cross-linking, and there is a combination between sugar and protein. These are called glycoproteins, all right? Now, when this reaction takes place and this combination takes place, the protein involved, the dermal protein involved is collagen, which is the essential framework that keeps us young, keeps everything nice and tight, all right? It prevents us from sagging, breast sagging, tummy sagging. Somebody asked me just now, do you do tummy tuck? All this is because of lack of support, where the structure of the skin, the collagen support has actually reduced or deteriorated. And so the next question would be, Doctor, when does aging start? So this process of glycation begins very early in life. And some have recorded it that from the age of 20, you really start the aging process. But the clinical symptoms of aging can start around 30 years of age. And that's why today, I might as well put a plug in now, that if you're really wanting to know how can I really prevent, because at the end of the day, you want to prevent the bad processes, the damages that take place, because at some stage when you reach my age, there will be age-related diseases. So how do we kind of prevent it? And so these tissues undergoing these reactive changes are damaged. because of this combination, this cross-link non-enzymatic reactions between sugar, which is glucose and fructose, and dermal proteins, which is where collagen is. All right, so this is something, remember. So what happens is that when this combination takes place, it makes the collagen brittle. You know, it's no more supple. You know, a baby's skin, you can feel it and you start pinching the skin and say, mwah, mwah, mwah. But try and pinch somebody who is much older. It's sometimes, you know, especially, and I'll explain later, it can be quite brittle, it can be quite tight, it can be quite, you know, hard to feel. And so that's why I spend a lot of time in my practice talking about the quality of skin. Many people don't know about the quality of the skin. And we are so busy sometimes in our life that we don't stop, look at the mirror, and just keep quiet and listen to what your skin is telling you. All right? Because we take it for granted. The only time we look at ourselves in the mirror is in the morning when we are brushing our teeth. And then we start saying, oh no, these lines are coming out. Oh no, this pigment is starting. But we never listen that the skin has been crying out for so long, but we don't hear. So this is what happens, and so this is the damage that takes place in the dermis of the skin, called glycated collagens, and they're very difficult to get rid of. Okay, so these cellular structures, they become brittle, they become sticky, and it impairs the function of the cell. So there is what is called cellular dysfunction. Now I know it's lunchtime, and I don't want to make all of you medical students, but remember, glycation causes cellular dysfunction, and the culprit here is sugar. Sugar kills the skin. Sugar destroys the skin. Sugar damages the skin. So, and I see that a lot in my practice because you know, I see diabetics who come here and they have regular treatment, prevention, trying to keep the skin nice and supple. All right, why? Because of sugar. And one of the tests that we do when we do our blood test to test the sugar level is what is called HbA1c, which is actually glycated hemoglobin. All right, and that's where we test. We see in 3 months what's the level of the blood glucose. How is this person managing their diabetic treatment? All right, and that's an indication. So that's glycated hemoglobin. All right. So what happens is that when we have these products that are byproduct of this combination, this reaction between sugar and dermal proteins, right? They are called advanced glycation end-products. Write it down. Advanced glycation end-products. Why am I saying all this at lunchtime? All right, AGE in short, which is aging. All right, in fact, it's fantastic mnemonic for the word aging. So these advanced glycation end-products, they turn up. They're everywhere. You can either take it in from your food, exogenous, or they can be manufactured from inside, which is an endogenous, right? So for example, if you're eating a nice fried chicken, Kentucky Fried Chicken, that we're having lunch right now, and there's something fried in there, that is where the advanced glycation end-products are going to come in. All right, so that's why it's very important when you talk about tobacco, when you talk about food, when you talk about sugary drinks, when you talk about, you know, later on I'll talk about toast, and even for that matter coffee. All these, you know, stimulate the production of advanced glycation end-products, and when they accumulate, they are the beginning of what is the heart disease that we see, the diabetes that we see, all the problems that happen later on in life. And so one of the main first symptoms and signs is when there starts to get wrinkles, when they start to get pigmentation, when the skin color becomes very dull, and you get this yellowish tinge. You know, all this is because of advanced glycation end-products. So that's the reason why we need to know why glycation is so important. And what is the treatment? How do we prevent these AGEs from occurring, which are the advanced glycation end-products? So just like I mentioned earlier on about the car, you look at the exhaust, and you see the exhaust, you know, brown and all that. You know the engine is dirty. Same in the body. When the cell is functioning, they are what are called end products. They are called bad actors. And these bad actors are AGEs, Advanced Glycation End-Products. And they get deposited in the skin. And that's the reason why when we talk about the aging phase, why is it that the skin, which is the largest organ in the body, it protects the environment away from us, keeps us nice and safe, prevents the evaporation of water and water loss, keeps us nice and hydrated. Why is it so important in my practice? I talk about hydration, I talk about moisturization, I talk about regular exfoliation, I talk about regular hydrating the skin. And these are things that are important. Why? Because if the skin is not nice and moist and healthy, you're going to have signs and symptoms of advanced glycation end products. Okay, so why do we need to know that skin glycation is so important? Why do we need to know? Now, very quickly, you notice that when I talk about the skin, right, the skin has got two layers. The superficial layer is called the epidermis, and the deeper layer is called the dermis. Now, this is what happens. And so this deeper layer, which is the dermis, right, this thick layer, is what it's all about when we talk about treating and preventing of aging disease. All right, so glycation hurts this dermis, and this is why all the treatment that we do here is to build up the dermis, because you know, as you get older and as the aging process continues, as we get these advanced glycation end products, we end up with these wrinkles, and these wrinkles can go deeper and deeper and deeper and longer and longer and longer. You can get them sometimes all the way down, wrinkles. It's because of glycation and end products. Okay, so it hurts the dermis, and the dermis collagen. Can anybody? I've already said it. The dermal protein. The protein in the dermis is called collagen. All right. So when we want to do any treatment, we will then build up the dermis. All right. So the aging of the skin is first to take place, and this is very important for us to understand. And it manifests as aging of the skin in the skin cells. Okay, now there's a cell down here which is very, very important, and I want to draw your attention. It's called the skin fibroblast. All right, so in the dermis of the skin there is one cell called skin fibroblast, and when you have advanced glycation end products, it reduces the functionality of this cell called fibroblast, and this decreases the secretion of elastin fibers, collagen fibers, reticular fibers, and all these make the collagen brittle and less functional. And that is the reason why in the dermis we have what is called the extracellular matrix. That means by the side of the cells we have the extracellular matrix. So that is so important. In my work here, I spend a lot of time building the extracellular matrix in a treatment protocol called matrixing. So that is why when they come in here to see me, the way to treat anti-glycation, the way to treat it is by means of a process called matrixing. So the symptoms that you see would be skin wrinkles, skin pigmentation, and the turning of the color of the skin, it becomes yellow. And if you go into the molecular level of the damage done, you will find that all this is because of glycated proteins. Okay, so this is something that is very important, and I want to stress that, you know, when you have high sugar levels, the skin ages even faster. Now I see diabetic patients and their skin is so rough, their skin is really tethered. And you know, I find that treating a diabetic skin is not easy at all, because all the damage of these advanced glycation end products are in the skin, in the dermis. All right, and so it's very important to have regular exfoliation. Go for regular hydrofacial, regular resurfacing of the skin. All right, if you are one who thinks that you've got beautiful skin, no need to go and see somebody to get it exfoliated. You're wrong. Because the body can only shed so much. But if there is damage to the skin, then those dead cells that are on the superficial, they have to be removed. Okay, so I don't know if you can see it over there, But these are the cells. Can you see? These are the superficial cells up here, and these cells need to be removed because they are dead cells. So the two most important cells in the skin, dermis and in the epidermis, that maintain anti-glycation symptoms or clinical symptoms, all right, is number one, keratinocyte, which are the skin cells, and fibroblasts, which are in the dermis. So remember that the fibroblast cell produces collagen, and the keratinocyte is the one that produces keratin. So this is very important when it comes to wound healing, when it comes to getting your skin nice and supple. These are the two cells. So whenever patients come to see me, the treatment that I always kind of think what's best for them is, how do I keep the keratinocyte healthy? How do I keep the fibrocyte functional? Are you with me? Because the keratinocyte is like your bed sheet. All right, you take your bed sheet every other week. You can wash it. If you've got acne skin, probably you have to change it even more frequently. But the epidermis is like the bed sheet. Remember that. But the dermis, which is this layer, the dermis, which is the deeper layer, this long layer here. Can you see this layer here? All right, this is the dermis of the skin. This is where the dermal proteins are. This is where glycation hurts and damages the most. You know why? Because this is where collagen stays. Collagen keeps the skin nice and tight, all right, and supple. All right. So the cell that is here is called the fibroblast. And so my job as a plastic surgeon, as a cosmetic surgeon, is to keep the fibroblast healthy. All right. And that's the reason why when I talk about how do I treat glycation, is by treating these two cells, keratinocytes and the fibrocytes. Okay, these are the two cells. Remember that. So if we recap, why is glycation important for us? Because it is the process that encourages and starts the aging process. All right, and it is reactions that take place, non-enzymatic reactions that involve cross-linking between sugar and collagen, which is the dermal protein. Just remember that. So these are called glycoproteins. And this cross-linking, these reactions that take place, they end up in the production of what are called Advanced Glycation End-Products, AGE. Just remember that. When we think of age, remember Advanced Glycation End-Products. And what do? These products induce aging. So what's all this about? That is, if we can control this production of these advanced glycation end products, if we can control them, got it, we can look young. So coming back to all this whole concept of anti-aging, remember, sugar is the culprit. Sugar kills. And there's nothing that we can keep away from sugar. I mean, till today I'm struggling. I'm struggling about sugar. Right? How do I keep? I've got a sweet tooth, and all my teeth are. How many teeth do we have? 36 or 32. All the teeth are sweet tooth, So it's tough, but it's important to know that if you can control your sugar in whatever you take, that's food that we take in, fried food, tobacco, smoking. All these things stimulate anti-glycation end products, and they speed up the process of aging. I see patients who are in their 70s and 80s and they look like they are 50s. And I see patients who are 50 years old and above who look like they are 70s. All right. So lifestyle, but most important of all is the way the food intake is and how do they stay healthy. Okay. So in the aesthetic market, how do we keep the glycation in control is what is called anti-glycation therapy. All right, and some of you would have seen in my post, my Instagram, of a patient of mine. I don't know if you can see from there, but this is the patient who came to see me. Lovely girl, and every time she would come and see me, I would sing the song Carol to her because she was such a beautiful woman. But she came in with her face just infested with acne, breakouts, oil, you name it. Everything was on her face. And she just get so mad. And so we went back to square one because I've never met her before. I don't know what her skin type is. and we went on to anti-glycation therapy, all right? And basically, it is to reverse all the anti-glycation or the end products that are being formed, advanced glycation end products, try and bring it all down so that the skin becomes more functional. Now, I want you to remember that the main cause when glucose and dermal protein or collagen combine together, it's a process called skin saccharification. You know, like saccharides, polysaccharides, disaccharides, all that, you know, when you're talking about carbohydrates, right? So the process of this combination is called saccharification. And during this combination of glucose or sugar and dermal proteins like collagen and all that, these products, this process produces what is called the Amadori products. And so prevention is the best for when it comes to anti-aging. And here we talk about smart aging. So the first thing is what I told you just now, and that is now I'm just going to the closing part of my time with you, is what do we do, Doc? And so, as I said, we do a process and packaging process here called matrixing. You know, when you buy a bed, what's the most important part of the bed? Which is the mattress. And so the more thicker the mattress, the more supple the mattress, the more thicker the dermis. This is the mattress, right? And this is the bed sheet, all right? The epidermis is the bed sheet. The mattress is the dermis, all right? So if it's more supple, then you'll find that the skin becomes much more healthier, more supple, the wrinkles are less, and there's volume there, all right? And so from having wrinkles, the wrinkles become less and less deeper and more shallower, and the patient starts to look younger. So that's the process of what we do here. It's called matrixing. And the main aim of matrixing, skin matrixing here, is to fight against glycation.